is the diastolic blood pressure. So overall, we conclude in called as a hypertension. So next we go on. This is a type. So generally we saw in the three types of hypertension like pre-hypertension and various type of stage like stage 1, stage 2. So pre-hypertension is a normal hypertension. Is the range is the systolic blood pressure is the 120 and 139, and similar to diastolic blood pressure 80 to 89. So if we go through in the hypertension stage first, hypertension stage first is a little or more than 139. Like systolic blood pressure is the range is the 140 to 159 mm Hg, and diastolic blood pressure is range is the 19 to 99 mm Hg. So second stage is the diastolic more than 160, and diastolic blood pressure is more than 100 mm Hg. So pregnancy induced hypertension called because of the increased production of the hormones and enzymes during pregnancy. So sometimes we find in pregnancy time we increase the hormones and enzyme releasing. So it's a increase the blood pressure. So it's called as a pregnancy induced hypertension. So primary etiology, what is the etiology? Etiology is primary hypertension. So elevation BP without an identified causes. And identified causes mean like we don't know how it's caused, but overall our blood pressure is also increased. And second type is the secondary hypertension. It's elevation of BP with exact causes. Type of account 5 to 10% of total cases. So causes of the secondary hypertension include the congestional narrowing of the aorta. Congestional narrowing aorta means like our arteries supply the pure blood, oxygenated blood. So its size is narrow and the blood is circulating is very pressurized. So increase the hypertension. Like is the causes like renal disease, endocrine disorders like causing syndromes, neurological disorder, brain tumors, head injuries, brain edema, medication like oral contraceptive pills, NSAID, and cocaine, such as other things. So included we in the secondary hypertension. So what is the risk factors? We have various type of risk factors in the increasing the hypertension. Like first the age, alcohol, smoking, diabetic mellitus, excessive dietary intake of sodium, and gender. How do excessive dietary intake of the sodium is to increase the renal and agitations, which is like gender, family history, obesity, secondary lifestyle, stress, also including respect of the hypertension. What's a pathology? Pathology means how to Pathology means it's how to cause hypertension and how to increase the blood pressure. The normal blood pressure is maintained by the four mechanisms like the sympathetic nerve system activates and activate the vascular endothelial cells, activate the renal system, activate the endocrine system. It's a four of the mechanism to maintain the blood pressure. Okay, like the sympathetic, how to work the sympathetic nerve system, like blood pressure equal to cardiac output into sympathetic systole will uh, so when the blood pressure is decreasing, the activation of SNS will occur. Now increase the sympathetic nerve system, increase the heart rate of cardiac contraction. Otherwise, we increase the SNS activity, so it's increase the contraction of cardiac muscles. So increase the heart rate, cardiac contraction, produce the vasoconstrictions in the peripheral artery, also or promote the releasing renin from kidney. The net effect of the SN activation of the increased arterial blood pressure, the increase in cardiac output, or systemic vascular resistance. Okay, so we orally be concluding in that otherwise these things include the sympathetic nerve system activity is increase, so heart cardiac out contraction is also increased. So we include in the blood pressure is the cardiac output into systemic vascular resistance. Okay, so we go through activity of vascular endothelium. So vesicular endothelium is a single cell layer of the that lines the blood vessels. It will produce vasoactivity substance and growth factor like nitric acid and endothelium etc. So these substances are the potent vasoconstrictions and causes an increased blood pressure level. So how to is activity of the renal system? First we saw in this with the bradykinin. Bradykinin is a weaker receptor activity. The nitric oxide is involved in the vasodilation and anti-hemolytic neurokines diuretics. So first we including the angiotensin. Angiotensin cotranine is the enzyme and is converting the angiotensin first, and ACE inhibitors is like is working the angiotensin second and activate the ATP1 receptor in aldosterone release. Okay, activity of endocrine system. When is the angiotensin second is stimulate the adrenal cortex, it's will secrete aldosterone. The aldosterone will stimulate the kidney to retain sodium and water, and thus the BP and cardiac output will be get increase. So, what is the clinical features about hypertension? Sometimes the high blood pressure does not causes any symptoms, so that's known as a silent killer disease. And in some patients, the symptoms will develop like severe headache, blood vision, dizziness, nausea, vomiting, fatigue, confusion, and chest pain, shortness of breath, irregular heartbeat, or papillary edema. So, diagnostic evaluation, what is the diagnostic evaluation? ECG, chest X-ray, medical history of diabetic mellitus, like call it IPDM, and history collection and physical examination, complete blood count. So, what is the management? How to manage blood pressure? Mainly, the management of hypertension is possible by two ways, like lifestyle modification, like reduce the high fat and more than intake dietary food, and pharmacological therapy like medicine. Okay, lifestyle modification like we including the weight reduction, dietary approach to we previously discussed the dietary sodium reduction, reduce the alcohol, exercise, stress management. So pharmacological therapy like various type of drug we use the treatment of hypertension like antihypertensive drug, which including the diuretics like the more and more than sodium is excessive production and like that. So it's help like we need to inhibit the sodium reabsorption and the lifestyle the convoluted tubules, ascending limbs and glucose handling. Like we included with two drugs of examples like chlorothiazide and furosemide. And beta blockers drugs we include the atenolol and propranolol, and alpha blockers also medication is a peripheral vasodilation of the blood vessel. Example of this alpha blocker drugs is a parazosin, and beta blocker drugs like reduce the workload of heart blood vessels purely because it is not a contraction of the artery, it's a dilate the arteries, so maintain the blood force and two drugs of including the atenolol and propranolol, including the beta blocker drugs, and also clear on the pharmacological activities and vasodilators increase the visual dilate, not a contract, it's a dilate. So it's medicine acting directly on the muscles will arteries and prevent the muscle from the tightening arteries or coronary. Called as a nitroglycerin sodium nitroprusside. ACE inhibitors we including the medication reduce the conversation agitation first and agitation second and the prevent the vasoconstriction. ACE inhibitors we including the captopril and Ramipril. So calcium channel blockers CCB. So it will block the movement of extracellular calcium into the cells and causing the vasodilation and decrease the heart rate, amlodipine and verapamil. So alternative therapy will be helpful to regulate the blood pressure, include the acupuncture, relaxation technique, and the diversional therapies. So nursing management is a proper history of the collection we've done. They include the family history also, like he or the family was suffered from diabetic and pre-hypertensive history. So dietary habits should be assessed. So identify the medical history such as disease, chronic, CAD, renal disease, etc. So interact with the patient and avoid smoking and alcoholism. Escalate the heart rate and calculate the peripheral pulses. So we include the identify the causes of the medication such as the contraceptive steroids or NSAID, non-steroidal anti-inflammatory drug. So monitor vital signs frequently. Provide diet which is low in sodium and rich with the fruits and vegetables. Monitor the blood cholesterol level